Welcome back to the channel, friends. Just wanted to give you an update. I had the pulsed field ablation procedure done on July the 8th, and today is July the 11th, 3 days post-op. Pulsed field ablation is done for atrial fibrillation, and I was diagnosed officially with atrial fibrillation this past March. It's been kind of a long process to get to the diagnosis. The issue really started about a year and a half ago. The last time I had COVID, well, no, actually, it started in 2022 when I had COVID. I had a rapid irregular heartbeat, and I think it lasted about 15 minutes. And then the next time I had COVID, which was in December of 2023, it happened again, but the irregular rapid heart rate lasted even longer. I think it lasted for like an hour, maybe 2 hours. And then I started seeing a cardiologist, and we started watching the rhythm with some devices like the Zeo patch, which you wear on the outside of your chest for 2 weeks, but it was never really clear and definitive. And then a year ago, almost a year ago, on Labor Day weekend, I went backpacking in New York on the Appalachian Trail for 3 days, and it happened again. And when it happened that time, I was not sick, and the irregular rapid heart rate lasted for many hours, but it disappeared by the time morning came. And then the cardiologist wanted me to have what's called a loop recorder installed. So it's basically the same or similar to the Zeo patch, but they actually put it under your skin. So I have it like sitting right here over the heart, and then it can monitor the heart 24 hours a day, 7 days a week, and it's not at all obtrusive. It's like the size of a USB stick. And then after I had that installed in December, I had even more incidents. So basically, the incidence of the irregular rapid heart rate increased in frequency and increased in length of time until finally in March, when it happened early in the day, and I happened to have the day off. So I actually went to the emergency room, spent the night in the hospital, and they were then able to decide definitively that it was atrial fibrillation with a rapid ventricular response. They changed my medications so that I have to take a blood thinner now, and they changed the beta blocker that I was on to a different type of beta blocker that has actually kept my rhythm in mostly normal sinus rhythm. And I still occasionally feel the rapid rhythm, but it doesn't kick off and last. So after they diagnosed me, they then recommended that I have this pulsed field ablation, and said that I'm like the perfect candidate for it because I'm young, I'm healthy, it's a new rhythm, it's really easy to treat when it's a new problem, and this is the latest, greatest technology, and it has very few negative side effects. And so we scheduled it, and I finally had it done. I'm extremely happy that I had it done. What I wasn't expecting was that it would pack the punch that it did, and I'm not really sure why I didn't think it would be that big of a deal. So the procedure is done in the cath lab, where they put a bunch of catheters in through your femoral veins. They actually used both femoral veins, and then they thread those catheters all the way up into the heart, and they take measurements, and they are able to visualize the problem areas causing the atrial fibrillation. It's really, really incredible. I'm gonna leave a link to a really simple animated video that, if you care to watch it, explains how the procedure is done. It's crazy, like how they can see all the tissue that's causing the fibrillation. And so they did the procedure, and I mean, most of the post-op concern is for the closure of the femoral veins, which are huge. Your femoral veins are huge pipelines, and if they bleed, you can bleed to death. So that's the biggest concern post-op, is that you don't do anything for like a week. No heavy lifting, no hiking for me, no riding a bicycle, nothing strenuous at all. I thought I was going to be able to go back to work. The doctor was like, no, you're a nurse. Your job is a strenuous job. You need to stay home for the rest of the week. So I'm on my second medical vacation of the year, and that's okay. This is a little bit of a slower time of the year, so it's okay. Anyway, now, so all I was thinking was that I just have to be careful of the blood vessels, you know, the femoral veins, and never even dawned on me or occurred to me that maybe my chest would hurt too, which seems silly to think about after the fact now, because they went in and touched the inside of my heart to destroy bad tissue. 56 different pulses that lasted 2.5 seconds each. And so I was really surprised when, for the first day especially, I felt like somebody punched me in the chest. And, you know, and breathing deeply was painful. Like that kind of pain when you were a kid. Maybe some of you can remember this, but remember when you were a kid and you would go swimming for 1,000,000 hours, and you were in the chlorine for so long that when you got out of the pool, it hurt to breathe. It kind of felt like that. I don't know if any of you ever experienced that kind of sensation. Anyway, so I had a lot, I didn't sleep very well the night after the procedure, but I had that issue when I had my hardware removal. I think my body is just hyped up on adrenaline. And then the procedure was Tuesday. Wednesday night, I slept much better. Yesterday, the pain was probably 90% gone, but I was still extremely tired yesterday. And I walked up one flight of steps in my building, and that was hard. And it was okay to use the stairs according to the post-op instructions. But last night I slept for more than 9 hours. And today I would say that I'm 99% feeling good. And all the groin wounds are fine. It doesn't hurt to take a deep breath anymore. And yeah, now I am just going to continue to sit around and rest and recover, and I'm allowed to go back to work on Monday with no restrictions. So that's that. It was interesting. The doctor said that he feels pretty confident that he's 100% confident that he killed all of the offending tissues that were causing the atrial fibrillation. And he even he even showed me a photo of what it looks like. So the tissue that they destroy comes up in color on the monitor, and then after it's destroyed, it becomes gray. So, yep. Now I wait for 2 to 3 months, and if the AFib is gone, they will stop my blood thinner and they will stop the beta blocker so that I won't have to take those meds anymore. And 80% of the people that have this procedure done it's not a cure, but it stops the AFib for years. And it's done, 80% it's successful with one treatment. I'm a little tongue-tied, sorry. So yeah, that is the update. I'm really, really glad that I did it. It was more than I thought it would be, but it was not that bad overall. And hopefully this treatment did the job and I won't have to do it again for many years to come. Just wanted to let you know how it went, and I'm excited that I'll be able to get back out and on the trail and not have to worry about my heart exploding, which will be fantastic. I hope you're all well, and I hope you're having a wonderful summer. And if you have any questions about what happened, leave them down below and I will answer them. Okay, see ya.